So, for the medical exam, once you walk into the room, you want to say, hey, do you mind if I write a few things on my glove? Because I have clean gloves. And yeah, sure, go ahead. So I write down all of my history steps and my vitals so that it's easier for me to get my patient report at the end. Okay, so as long as you walk in with clean gloves, you can do that. So, for the medical exam, what is my dispatch?
You are called to a 16-year-old girl who ate lunch and is now restless. She has diabetes and is upset.
Ate lunch and is now restless, diabetes and is upset. Okay, so BSI, is my scene safe?
Yep.
Okay. My nature of illness seems to be a diabetic issue, and I only have one patient. Is this correct?
Correct.
Additional resources, I would consider calling ALS, but I'm going to check the patient out first. Then for spinal, I'm not going to assume spine at this time. So I'm going to come in, my general impressions, probably good to bad, somewhere in there. And I'm going to come in and assess the level of consciousness. Hi, my name's Tony, I'm an EMT. Can you tell me why you called me today?
I don't know what's going on. I just feel so sick.
Don't know what's going on and you feel sick. Okay, so she is alert and seems to be oriented. Her airway is patent, and is this correct?
Yep.
Okay. And so real quick, I'm going to assess her respiration. So I'm going to act like I'm holding her pulse. I'm going to hold. Will you please breathe through your nose? I'm going to be looking for chest rise and fall and feeling for respirations for the next 30 seconds. In interest of time for the video, I'm going to say that she has a respirations of 16 minutes. What are my actual respirations?
You hear small respirations, and then it's about 10.
Small with 10.
Whatever. Yeah. No.
Small would be more like 20.
I'm gonna say 24.
24. Okay, so she's got small respirations at 24. Okay. And
I'm confused.
She's very confused and not oriented at this point. Okay. I'm going to auscultate her lungs. Okay. So I'm going to listen to the back side of her lungs. Take a deep breath. And listen to the other side. Deep breath. Okay, and it appears to be clear.
That's correct.
Okay, so lung sounds are clear. And I'm also going to check for a pulse. 30 seconds, and what's my pulse rate?
58.
Okay, well, I would say her pulse is roughly 68. But what's my patient's pulse?
58.
58, okay. Okay, so patient pulse of 58. I'm going to check for any major bleeding. Do I see any major bleeding?
No.
Okay, and skin conditions appear to be warm, pink, and dry. What are they really?
They are warm, pink, and dry.
They are warm, pink, and dry.
They're warm, pink,
Okay.
and dry.
So, with warm, pink, and dry, and she appears to have good coloring everywhere else, I'm going to, with the respirations of 24, I'm going to start her on a non-rebreather because she doesn't seem to be cyanotic at any point, but if it doesn't seem to be adequate, I'll switch her over to a BVM so she's right on the edge of needing it. I'm going to do a quick rapid scan, look for any other injuries. Have you passed out or anything? Did you ever fall down?
No, I just got really lightheaded, but I didn't pass out.
Really lightheaded, didn't pass out. Do you remember hitting the ground or anything?
No.
Okay. Do you have any pain in your head or neck or anything?
No, I just, overall, it's just...
Just don't feel good. Okay. So, completed my rapid scan. My transport decision is going to be probably a load and go just to be safe. And now we're going to get in the ambulance. I'll put her on a stretcher, cover her with a blanket to keep her warm, treat her for shock. And now we are going to take a history. So, when did this begin?
It began about 3 hours ago.
Okay. And does anything make it better or worse?
I prefer to sit up.
Prefer to sit up, okay. And can you describe, are you in any pain? Can you describe how you feel?
It's not really pain, I just feel like I'm going to pass out, just overall sluggish.
Okay, so no really pain, so obviously don't have any radiation. On a scale of 1 to 10, 1 being the best you've ever felt and 10 being the worst you've ever felt?
7.
A 7, okay. And is it constant or is it come and go?
It's constant.
Constant, okay. Are you allergic to anything?
Mm-hmm.
Okay. And do you have any previous medical history?
I was diagnosed with diabetes, and they gave me an insulin injector to take.
Okay. Are you type 1, type 2? Do you
Type
know?
1.
Type 1. Okay. And are you on any medications other than your insulin?
Mm-mm.
When was the last time you took your insulin?
Last night.
Last night, so you haven't taken it today?
Mm-hmm.
Okay. What was the last thing you ate?
I had a cookie about 3 hours ago.
Cookie 3 hours ago. Is that all you've had today, or what else? That's it?
I know I had some cereal this morning.
Some cereal. Okay. And what were you doing when the pain kind of started?
I just started eating my cookie, and then I started to feel sick, and then I kind of got a little faint, and my mom got scared. That's what she called you.
Okay. So now I'm going to do a secondary exam, and I'm going to do a focused exam, and with her being diabetic, I'm going to reassess her respirations. And is she still Kussmaul? Do I need to put a BVM on her, or does it seem to be adequate with the non-rebreather, 15 liters?
Seems to be adequate.
Okay. I am also going to take blood glucose levels, so I'm going to use the BG monitor, prick her finger, and take glucose. What's my glucose?
180.